Hello everybody, we have got a fantastic live that we're going to do. We're on Facebook. We're on Facebook, and there's a woman I've been following for ages called Anastasia BeautyFascia, and she has changed face shapes. She's mesmerizing to watch. You can see how she manages to really work with her fascia, which is this little bit, she's going to describe it to us in a minute, this little bit of tissue that is underneath your epidermis and just below your lymph and before your dirt. It sort of sits in the middle. She will describe it properly. And I discovered her, she had like 400,000 followers. She now has literally 2 million followers, but she does, I did this course with her too, which I signed up to, called the Glow course, and I must admit, after about 20 days, I stopped it. It was a 30-day course, but I learned a bit of her fascia stuff, which I've shared with you guys on Instagram and a little bit on Facebook. We're going to do it today, and I'm going to get her on, and we're going to do it today. So if you're watching, find yourself in a room by yourself, because we're going to be contortionists. And what's really important, and she's going to describe it, is how we do we open our lymph first. So at the beginning of this, we're going to open our lymph, which is a thing I've done with you guys of this stuff, which I learned from her, and this, and then inner thigh and back of knee. And then we're going to do this stuff, and the lifting, any of you have her hooded eyes, the lift she has got from her eyes, and she shows you before pictures and after pictures, is staggering. So if you're thinking, should I resort to surgery, or I wish I could afford surgery, this is just time that you need. And I'm going to ask her specifically to do the hooded eye one and the jowl tightening one, because I think when I listen to what you're all thinking about the most in terms of when we look at ourselves and think, oh God, how am I looking today? That gets us down a bit sometimes. Sometimes you might not give a shit, but I think you can just feel. And the jowl, the slackening of the jowl. But it's the overall contouring of the face that she does brilliantly too. So I'm going to get her on now, and tell your friends who you feel might have this too, and we can all do this together. So.
Okay, I need to try and find.
Okay, so she's going to be watching us, and hang on a second, 1 second, we've just got something here. Oh wait, she might coming in, is that her coming in? No. Anything good for a turkey neck, I'm sure we can do. So people plus people we're doing.
Yeah.
So we've got, so she's not there
Okay,
yet. Are we on Trinny London or Trinny Woodall?
Trinny Woodall.
Yeah.
Let me check.
Okay, we've got to just find to get her on. I mean, it's just, what we can do whilst we're waiting for her is we can do turkey neck, hooded eyes. That's what we're going to work on today. And it is amazing. So whilst we're figuring out how to, we could get you all to do the lymph opening, which is what she's going to ask us to do anyway. So are you up for that? And Anastasia, if you're on, can you just say you're on? Because I can't see you on, the people who are on at the moment. So I'm just trying to find you.
I'm just going to chase her now.
Yeah. Because it might be she thought the timing was different, because if she's in Austria. But it's brilliant stuff. So should we just start with the opening of your lymph? So there's a place between your clavicle, your collarbone, and your chest bone, which is here. And so you are going to do this movement of moving out. You put your knuckles down, and you can let it get a little bit red, and you're going to do 10 like this. We've got the glass on so I can see you. Like that. 10, and we're going to do tapping. 10, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then we're going to go the other side. 10. And you usually do it to, what's the clock timer called? It's not called a pedometer, what's it called?
Metronome.
Yeah, and that's, you do it to the tick, 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 like that. But she has got just incredible results around her eyes. And I found when I was in Australia, I did it. I first learnt about her when just about a month before I went to Australia, And I noticed, and Australia was really a lot of work and quite stressful, and when it is that little sleep, my eyes get very, very tired. And I just felt this lift, and I was doing also this other one of, do you remember? So then we're going to do the side of our lymph here. We have a lot of lymph nodes around in front of our ear and behind our ear, so we're just going to do that. So do that with me 10 times. It's about getting the flow, and then we can tap, and then there's no harm in pulling your ears out as well, like this, pulling your ears out. Then we're going to go under our armpit, and we're going to go 10. You can do it with your clothes on or off, you just need to feel that you're getting in there, and then tapping. I'm going to do the other side. Are you doing it with me, guys? Don't want to be doing it by myself. We will be getting hold of Anastasia. We've got technical hitches, but when she comes on, hopefully we've done a bit of the prep work. Then we're going to go to our stomach here. And with the stomach, you just do this movement of like that. 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. There. And then we're going to go down to our inner thigh. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 3, 4, 5, 6, 7, 8. And then behind our knee. Go up and down 10 times. 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 8, 9, 10. Now a few other things that she really recommends. And this is something that I understood after watching her. This is across the top. Of really appreciating that a reason we get hooded eyes is that we have a weight of no movement of our fascia, so things go down because there isn't that lightness, there's an attachment, and in a way what you're doing is you're moving the fascia, the deep tissue, so that it's not weighing down on your eyelids. So there's a little bit of going into your hair and just pulling your hair a bit, which is something that feels weird, but it's a really important thing to do in all different directions. We can do this whilst we're waiting for her. And this is sort of waking up, in a way, your tissue on your hair. So you take 2 bits of hair and you do it back and forth, side to side, around, clockwise, anti-clockwise. And you take each bit of your hair. She's also got fantastic hair. And this is stimulating too for the hair follicle. You're not pulling like you're trying to pull your hair out. And you're not going to pull your hair out. But just doing this, this is one of the exercises I did with her, and you can feel when you do it that you are moving, in a way, your scalp, the top of your scalp, from that deep tissue underneath, and it's about getting this movement going of our deep tissue. So we're going to do this. And all of this is going to help us then get to working on our eyes. It's like you don't always start on the area that you feel you most need to work on. There's work you need to do around it first. All right, so like this, a little bit more over here. And then at the back. And then also this kind of really massaging and moving your scalp against your skull. So really feel that movement here, releasing that skin in a way from the scalp. That's that feeling you should get of moving up and down. All right, you all doing it? You can do that here too. Really feeling that movement. All right. Oh, I like this, says Joe. Now, we'll go now whilst we're still waiting. So I can't do it with her. I'm going to do my best endeavours. Have we got some more? Do we think she's on yet?
Let's have another check. What we can do is we can hop off and hop back on and invite her to join us that way.
Well, we might do that. Should we do that?
Yeah.
Let's do that. So all stay, and I'm going to come back on in. All right. Good morning, everybody. Today we are going to learn to lift hooded eyes, tighten our jowls, and we're doing it with BeautyFascia. I have invited her on. She should be joining us in a minute. If you're feeling broke but would like to reframe your face, this is your free introduction to the idea of fascia exercises for your face. This is a sort of deep tissue exercise for your face. And I've been doing on and off with her since probably November. And I've noticed when I do it, an unbelievable difference. Now, she shows before and afters on her Instagram. You go, oh my God, that must be surgery, or that must be Botox, and it's not. So I love it that we can all do it together now, and she should be joining us, I hope. So let me just see now if she's coming, bring them on the video. Let me just see her there. There.
She is invited.
She's invited. Okay. All right, so we'll see how we go.
Yeah, we have sent her an invitation.
We sent her an invitation. All right,
us.
she'll be joining in. And if you get in touch with her team now. All right, so I'm just going to get cracking on for those of you who have been watching. We've done an intro of opening up our lymph. And before you do any facial exercise, it's really important to open your lymph, because facial exercises are going to a mixture of release toxins from your face, which could lead to puffiness and immobility. And that just is lying in your lymphs, and they become a bit stagnant, and so you can feel puffy. Lots of things can make that happen. It could be free radicals, food, bad sleep, lots of heat in your room and not the right airflow, lots of things. So the other element to fascia exercising is you're moving your scalp. You're getting the separation between it sort of sticking too much like glue to your scalp. It sounds weird, but the weight of that makes you have more hooded eyes, etc. We always think hooded eyes is the slackening of skin, but it's also this deep tissue fascia. So the other thing she does, and this is a crucial thing for the audience of who I'm talking to now, is looking at our posture. And when I've done my course with her, which I did about 20 days of it, a lot of the work that we did, like for the first 10 or 15 minutes, I was like, oh, really? I wanted to get onto the beauty bit straight away. But I appreciated then, after doing this for a few days, the importance of getting this posture right and doing this, you know, getting the flow going here. And we did some stretchy bands where we had to relax our neck and pull it back. Because I want a great posture as I go down the path of life. I don't want to get what we used to call a duchess's hump. We can get a thickening here of our muscle, because posture, we just slowly can do that. I want to be opening up. It's going to help much more for my breathing, and therefore for wellness, because I'm going to get more oxygen into my system, which is going to move around my body. All of the benefits of posture are much more than just standing up tall. They are about giving your body the best position to function at the most optimum level. So I'm so irritated we can't get her on, because she's fantastic.
I'm trying really hard to get in touch.
Yeah, but it's not happening. It's not happening.
Still not there.
Dowager's hump. Sorry, did I say duchesses? I gave the wrong title. Dowager was always in British aristocracy. A dowager is the mother of a current existing female member of the family who's in charge. So that would be a marchioness, a viscountess, you know, and it would be dowager, marchioness, dowager, viscountess, whatever, the dowager. And so that's where the expression dowager comes from. But how many of you are thinking now about, I need to look at my posture, I need to look at how I hold my body, that you'd like to do this? Because we will make sure it works next time, if it's not going to work this time. And I've got to say, I don't know if it's going to work. This is from Tibby. Hello, Ireland. We had the best time in Ireland. We really did. It was such an incredible reception.
Still nothing.
Still nothing. No, still nothing. You don't think she thinks she's on Instagram?
No, I told her.
Sure?
Said Facebook for
You
sure.
Did? Okay.
For sure, Facebook.
All right. We could go and do it on Instagram if, I mean, it's not so good, but we could do it on Instagram.
We could. it was their request to have Facebook.
Oh, it was?
Yeah.
All right, fine. So do you want to get in touch now and say, what about Instagram?
I can
or not? How many of you have Instagram, by the way, who are watching me now? I just love to know. I'm 51 and I still do ballet and de pointe, so my posture is good. I mean, that's so good. Makes me want to stand up here. Definitely interested in this topic if you can make it work with her. I know I'm really not aligned on this. Hello from Sydney. It's a shame she can't get on. I know, it's so irritating. Sabrina, yes, posture is so important to me. I'm in a screen at work all the time. Definitely have this hump you referred to. I know, let's all sit up tall and move our shoulders as we talk about this. There we go. Yes to Insta. All right, that's good to know. Yes, please. I'm very interested in improving posture. It's also the fact that this is something, because I think there's elements. There's 3 elements to look and feel of how we are, or 4 elements. There's sleep. Getting the right sleep. Last night I didn't have good sleep. My dog is not very well, and I just didn't sleep. We have diet, food, what we eat, the energy we give our body. We have skincare, the daily routine we put our skin through, giving it exfoliation, giving it nutrients. A lot of it is, there's 2 elements to skincare. If I break it down really simply, there's protection from future damage, which is SPF 50, and there's repair of past damage, which are retinoids, vitamin C's, peptides, good cleansing routine, exfoliation. It's that simple, and you can pick up the simplest routine and build on it, skincare. And then there's sort of tweakments. There's things you can do that are extra. There's Botox, which people do or don't do. You could have a facelift, you know, there's all that kind of extreme stuff. So beauty fascia, I mean, you know, deep tissue fascia treatments on your face and body do go to 2 points here, because one is health and your body working really well and getting that flow for your body of your lymph system and posture and oxygenation, and the other is aesthetic, of not wanting to go and do tweakments or to do Botox or to have an eye lift or to have a lower neck lift, etc. Now, will it actually be the same as if you do a lower neck lift, or will it be the equivalent of doing Botox? Anastasia, interestingly, feels that many people suggest to her she must have had Botox, etc. And she goes, look at me before and look at me after, and she hasn't, and she's done it all through this work. It takes time. That's the thing, it's how much time we all have. And sometimes we make decisions because we don't want to take the time to invest in them, because she would like it if every day you could do 30 minutes on this. Now, 30 minutes for me is a lot to do some facial exercises, and usually in the morning I do about 10 minutes of facial exercises. When I did her course, I did her 22 minutes and then the 10 minutes to open up my lymph and do other stuff. So I was doing quite a lot, but I was getting up at 6:30 to do it. So I love Wendy. I'm all for Botox. So some people just want a quicker solution because of the lifestyle they have, and it's a personal choice. There's no judgment here. Some people would like to say, I've got the time to invest and I don't have also the money to spend, so I will do that because I really want to feel my best. Then we can also discuss the concept of how much you feel it's a vanity matrix or it's not. I believe for me it's about, I want to look in the mirror and feel I'm full of energy. And I will do everything I can to have that feeling, to get energy in my face, to not look tired. And so I do things to make sure that that's where I can be.
She should be joining us now. We've had a message that the time was confused, but she should be joining us very shortly.
She's hopefully joining us.
I thought it was 11 AM. She's joining now.
Okay.
So
she's joining. She's joining. I'm going to look now and hope that she is. And I'll do a new introduction then. I haven't got her yet, so I've got. Is it under Anastasia?
Anastasia BeautyFascia.
Yeah, and it's not here.
But she should be joining with the invitation that we sent her.
All right, fine.
So maybe we could do a quick massage routine together.
I think we could do a quick massage routine together. I think we could do a hooded eye one. She'll want us all to do the lymph. So I'm going to say you've all done the lymph. So have you all done the lymph that I asked you to do at the beginning of the lymph opening? Have you all done that? Because it's really important. Anastasia wants to join me on a video. There she is.
Amazing.
Okay, so approve. Send invitation. And she should be coming on. Adding, great. Oh my God,
Hello.
so excited to see you. Now,
I'm so sorry. My team said 11 a.m.
don't worry at all, darling. Now we've got an intermittent audience because some people felt that they didn't know if you were coming. But what I'm going to do at the end of this is I'm going to also take this film and then we can post it again, edited. So I'm just going to give, for the sake of our film in a minute, I'm just going to say I'm here with Anastasia BeautyFascia on Instagram, who I've been following you since November. And before I went to Australia, I discovered you, Anastasia, and I was thinking, this is what I love. I do everything you don't do. I do Botox, etc. But I'm fascinated by learning. And then I was saying to the audience now that I signed up for your Glow course, and I did about 20 days of that. And it's an investment, you know, it's about time to invest in yourself and how much you feel you want to go straight to a quick route. But I want to show there is this alternative route that you talk about so eloquently of you can do this yourself. You don't need to go and do Botox or anything. And all it takes is time and your fingers and going on one or two of your courses. And you do quite, I hope you're doing, are you doing another Glow course soon?
Yes, yes.
Great.
Actually, the registration starts tomorrow, but
Okay.
the wait list is so full.
Yeah.
So I encourage the people to get familiar with these techniques and with this method on my Instagram, on my TikTok, just to get a hold, because when I started this, I realized that a lot of people had no idea about this, had no idea about
So
that.
will you explain, should we go back, Anastasia, and just explain that there's kind of, you know, for years I did just little massages, but you do fascia. So let's start with the 101. What is the difference between a fascia, facial massage, and body? Because I know we're going to open the lymph at the beginning, and I already asked them to open the lymph because I followed your lymph opening protocol. But will you explain to the audience what it means and what it's doing?
Yes, the connective tissue of fascia, this is a subject that hasn't been studied for a while, because anatomists, when they looked into the body, they had to, in order to look at the body, you have to cut something out. And they cut fascia because it's all over the body. But right now, whole scientists are looking at it because it is all over the body. It consists of our water, it is our collagen, it is our elastin, it shapes us all over the body. And with time, it gets adhesions and fibrosis, again, all over the body. So scientists start looking at it. So fascia is a connective tissue that shapes us, that nutrients us, that actually, I'm pretty sure in the next 50 years, we will hear more and more about fascia and about what is, if you think about it, are we 800 muscles, or are we one muscle in 800 pockets?
Okay, I love that. And the fascia is sitting in between. So if we just, on a practical level, the way I've described it is you have your epidermis, you have your lymph, and then you have this muscle tissue, collagen, elastin, which connects us like at our skull, that bit in between you. When you move this, you're moving the fascia,
Everywhere on the body is a fascia. I think it's a great example. It's very primitive. It's a grapefruit. If you think of the grapefruit and the water, it's super watery, but it's not like just spills all over you. It has this white little parts. That's our fascia. That's literally shapes us. That's literally shapes us. People look in the fascia as on all of the diseases that, you know, included the fascia. You can see the pain. You also, like, I'm a big fan of fascia. You also can say that actually the muscle has less nerve endings than fascia. So pain is actually not in your muscle, is in your fascia. So it's very big for the health industry. But for me, I was more fascinated. Okay, what can you do for the face? We clearly, for some reason, the massage therapy, it goes up to here, you know, and a little bit of this and this for the face. But I know that you can change the face by working with fascial system on the face and understanding that your fascial system is a connective tissue, that system that literally, if you have a fascial pull in your posture, it doesn't happen in a day. The fascia is slow. The fascia is
slow. I mean,
plastic.
it is like a month, isn't it? Before, well, I mean, I actually felt though after a week, well, like, I think what would be very helpful, Anastasia, there's somebody also has a question about Hodgkin's lymphoma. I can't read anything. What's the question?
Yeah.
I've got one question, just to...
Is it okay to do this if you have had non-Hodgkin's lymphoma?
If you've had non-Hodgkin's lymphoma, is it okay to do this?
Lymphoma. Well, you have to. I always say it depends on the stage of their current situation. So if you are allowed to do massages, yes, you can do it. But again, to be safe, I always say to ask to the doctor if you can go deep, with deep technique, with deep pressure, because you know I have to look at the
That's
person.
just because I think there's people who want to join us now, and if somebody has it, I think we would say to them doctor's advice first.
Yes, I you know, I always, it's the same as like pregnant woman, all of this, it's all different journeys. Some people are, and you know, because working by tagging into the fascia, you changing it permanently. This is where you say, oh, I did this massages, and if you go to esthetician or cosmetologist, what they do, we understand. We have skin, and it's not like my t-shirt. It's attached to the fat, which is a good thing. Fat nourishes us. Fat actually a good fat hides some imperfections of our face. But fat, it's a fat cell. What the fat cell does, it attracts more water. So if you have a problem with puffiness, that fat cell will attract more water. And it's so unfair, but on our face, we have different fat. We have here fat parts, hey, hello, eye bags, right? When these fat parts attract more water, it doesn't look good. It's not like a pure, you know, it's getting, then the fat parts start moving and things like this. So the first thing that you experience when you work with your derma, you remove the fluid, but it doesn't change your structure. Fascia changes structure.
Okay.
But muscles also have the fascial pockets. The muscle has also, it's a muscle in the fascia, and inside it also has a different type of fascia. So you can plastically change it. When I say plastically, people are like, what is this? I'm like, imagine plastic bag. Imagine plastic bag and permanent deformation for your plastic bag. It's when you slowly, very slowly, you don't want to poke it, right? You can break it. You can't break fascia, but you want to touch into the fascial compartment of plastic. You plastically change it. Versus muscle fibers, it's a little different. Muscles, you can pinch, you can vibrate them. They love that. They like the nerve endings, the Pacini, the Ruffinis. They're like, oh yeah, great. But the fascia's approach is different, and the lymphatic massages are not permanent because fluid comes, fluid goes. Yes. And what else people don't understand in the lymphatic massages? Everybody is obsessed with like lymph nodes. Me too. I know that. I studied that.
Because you start with opening your lymph when I've done the massage with you, it's with the metronome doing this, which I've asked everyone to do, you know, and then the stomach and that. So they've all done that. I wonder now, could we do one, like do maybe the hooded eye one that you show, just so people can start to get involved and work with us?
Yes. And I want to, you know, I'm very realistic about this. Lymphatic system flows through lymphatic channels. Fascia and fat, so speaking of fat, fascia is embedded in fat. So it's like goes like this through the fat to your skin. And then if the fascia is tight, which is actually a wrong word, but if the fascia has adhesion, that lymph flow is not going. So you need to remove those adhesions. So we open it here. This is one of the most powerful for our face. Then we have to go into the side of the bigger lymph nodes for our neck, which is sternocleidomastoid. Your muscle sternocleidomastoid, you can find it by pressing with your...
Are we going to do this now with you? We're doing this now.
Yeah, we can.
Okay.
We can give couple exercises so people start exploring, and then we can chat and then give another exercise.
That would be brilliant. Let's do that.
this is a really time to introduce yourself, to your neck, to your face. Beauty industry been saying, oh, don't tug on your face, don't tug, you can cause more skin wrinkles. And the solution that they come up with,
I think everyone who follows me knows we touch our face a lot, because I do it all the time.
we touch.
So you're with an audience which does a lot of touching. Yeah. So we're there. So what are we going to start with?
We're going to start with palpating our sternocleidomastoid muscle, which is this big muscle that holds your neck. It's a superficial muscle. Here you push with your forehead, and right now you take, this is platysma. This is platysma in skin. The muscle is, you see, it's really big one. It's like
this. Yeah.
Yes. You're going to be gentle. You're going to be listening, because obviously this muscle is a gate for your jugular vein. It's a gate for your carotid artery, and the fluid, the lymphatic, all goes to the jugular vein. And the only thing that can change your skin is your arterial blood. And arterial blood goes through the carotid artery. So you're already tagging on the pass. You're opening the pass. What you're going to do, you're going to gently, especially I'm interested in the area right below your ear. You're going to gently start seeing, is it painful? Is it feels a little stuck? Can you pinch it a little bit? Can you move the tissue on top of it towards the back of your neck? Can you roll it towards the back of your neck?
The tissue on top.
The tissue on top, yes, the fascia on top.
Okay.
You're going to be rolling it towards the back. How does it feel? You're going to lower not compressing your shoulders, but you're going to start. And then once the tissue is already warmed up and quite soft, you're going to start taking a little more and more of the muscle in it. And you're going to start palpating it and seeing, are there any spots that are actually very painful? Then you can have one hand here, like basically opening this, and another hand just making those circles. Like you are pre-tensing in order to go deeper, right?
I'm looking down here just to say, Anastasia, because I've got lights on here and I can't see the screen because the phone is too hot. So when I'm looking down, everyone, I'm looking down at another screen, looking at what you're doing, just so people can see that. But everyone follow Anastasia and follow what she's doing. Okay, so one hand is just doing little movement.
Little things, and you move the tissue towards the back, because with our current technology boom, we're all here. So the tissue, together with the gravity, together with our postural habits, together with really literally bringing our head forward, the tissue, that saggy neck happens because the tissue from the back of the neck has moved towards the front.
Okay.
So obviously,
so we want to move it back again.
Yes, you want to move it back. You want to give the muscle.
So I'm holding on. So with this hand, I'm holding on, and then with the other hand, I'm pushing it back a bit. With
one hand, you pre-tensing the tissue, because we were holding it before just to warm it up. Now you pre-tensing the tissue, and you going with the circles.
What do you mean by pre-tense, Anastasia?
Pre-tense, it means, like for example, here I cannot really go. I need to pre-tense with one hand, then I can go deeper. Versus I'm trying to, you see this fat, all of this, it's a little jiggly, jiggly.
So
versus
you mean I'm holding it?
Yes.
You mean I'm making it tense?
Yes, you make
it
tense. And
I'm sort of stretching it out, making it tense. Great. Okay, I didn't understand pretense, because a pretense can also mean something else. So I didn't see that. Okay, great, good.
Yeah.
Well, Anastasia, where are you from? Where are you from?
I make up my own words.
I know, but I do that all the time. I know that feeling. Where are you from?
Well, I'm originally from Eastern Europe,
but
I've moved to America when I was like 18. I went to college there, so.
And do you live in America?
I live a lot. I actually travel a lot. from maybe 2018, 19, I started traveling around the world, and this is kind of how it led me to connect all of those practices, because I had different teachers from different countries, and they're all brilliant. I didn't know it's gonna lead where it leaded now, but clearly doing the good stuff. Trinny, do you feel any painful spots, or it's
I feel
all...
a tension, you know, I feel
feel
a
the
tension, maybe. I'm quite stressed today. My dog is very ill, so I'm a little bit, I've had a difficult morning. But so probably that, but that's probably it. But I just, not too much. So I feel, how long do we work on one side, Anastasia?
You know, this is a tricky question because everyone is a little different. You are a representer of a slim lady, right?
Yeah.
So you're right here. You go and you're right there. For somebody who is never done any practices, for somebody who's in this position, they will need a little longer. For somebody who just has a thicker skin, they will need longer. They will need longer to warm up. Everybody's strength of hands is different. Some people are just panicking touching their neck in general. Even so, besides carotid artery and your jugular vein, it's also the vagus nerve right there. So you're already stimulating your parasympathetic system to go and regenerate. To go.
So to remind us again, if we go to the other side, we are taking in our opposite hand. First
we finding it. We finding it to go deeper. Secondly, we start warming up, especially we're interested in the area at the beginning. We pinch it a little bit. We pinch it, we introduce ourselves, we increase the temperature in the tissue because fascia changes when it's warm. That's why a lot of things
works better.
It's like you know, it's plastilin, you know, this plastilin that you
like hard plasticine for a kid.
Yes,
you need to make it. The word is we're making it malleable.
Malleable.
That's the word.
Perfect.
Malleable.
I love that.
Which means you can move
malleable.
it.
So it's warm, it's increased temperature. Secondly, your receptors are working right now. Your body is like, oh, she's on the neck. Is something is happening? Is it there is a foreign object? Is there is a virus? No, it's her. It's her. It's good, you know. And blood goes here. No, this is exactly the conversation your brain is having. Why she's touching? Like, and that's why the face massage on yourself, I love more than when somebody doing a face massage to yourself. Because your nervous system doesn't take you the threat, and face and neck is pretty intimate for a lot of people. Like, you know, like it's not the elbow, you know, that you can cut, you can cut me on my, but no, your nervous system will be like, excuse me, like it's, is it, who is this? And here it's like, oh, it's me. Oh, good. You know, let me see what she wants from me. You know, like, let me see. And then, plus, another thing, when you touch consistently yourself, you mapping your body. So a lot of things, just in general, in our brain, a lot of things are more in a shadow. Like, for example, you don't really feel the back a little bit on top of the back of your neck, like you kind of on your knee, you feel your fingers, you feel your tongue. It's just the way it's our brain maps. So whenever we consistently inputting the information in our nervous system is mapping it, mapping it. It's like, oh, she actually cares about her sternocleidomastoid, about the tissue. And if the tissue, if the muscle and fascia underneath your skin is healthy, the skin will benefit. The skin will get that carotid, that arterial blood. The skin will get that bad fluid out, that metabolic exchange of the cells out. This is what's
Anastasia, I think, can I just ask a couple of questions, because I know the answers, but it's good. So somebody says, does this replace gua sha? To me, it's very different, because gua sha is just working with the lymph,
Gua sha is just a tool. It's just a tool. Secondly, if you talk about like the program and the techniques that I do, like on a private settings, we work on periosteum. Why? Because one of the biggest problems in our face, problems, I don't like saying problems, but let's say challenges, right? It's a bone resorption. We losing the bone. Our bone structure becomes smaller. So the tissue is like, I
don't know. I've got, there's not so much for it to go on. So is it then that we're not repositioning the tissue, but we're allowing it to reattach to a smaller area of bone density?
We're not only repositioning in a better position, but working on the periosteum and working on the periosteum fascia with piezoelectric technique. It helps osteoblasts to work better. We stimulate the cells that create the bone. So there's the cells that destroy the bone, and we stimulate the cells. And it's been proven. It's like 140 researches about this. So gua sha will never be able to go to your periosteum. It's a tool. It's a stone. You will hurt yourself if you try to go to the bone. You don't feel it. You don't feel it. Your nervous system feels like you are doing it with the stone. But it's great for lymphatic lymph moving. It's great for just like a little tool. It's great for maybe superficial little wrinkles just by bringing the blood circulation. But it's, and Trinny, for people like you that already lifted, that already don't have that much puffiness, they cannot do gua sha. You're gonna remove your lymph. You have zero. You have very little. You're gonna remove it more, and until the arterial blood comes in volumes is on, you're not gonna it's gonna look slimmer, not in a good way. You know what I mean?
Like one could be drawn, perhaps. I mean, I do gua sha very lightly, just to do a morning lymph, which I think is fine. I don't do that very deep gua sha. I just think I do this, but then I could easily do that with my hands of just doing it. Could we do, Anastasia? I promised everyone we would just show one technique of because I find your brow lift really interesting, and I know that you have this as your pinned film also on Instagram. But I'd love us to do it now together, because I'd love you to just take us through the technique of that, and I could ask you a question or two as you do it. Is that okay?
Yes, absolutely. Brilliant. When we talk eyebrows, we talk upper part of our face, and we talk one of the largest muscles in our skull. It's temporalis. So we will do a little extra that not only I have on the pin, but a little extra. So first we're gonna place our hand right on the lateral edge of so we don't drag this tissue, because this belongs to eye muscle. We don't want to disturb that. And then, so we're gonna pin it. So, if I pin it, I cannot move it. Pin it. And then with another hand, first, we're gonna start with vibration again, because muscle loves it, your cell receptors love it. Our body loves vibration, right? So we're gonna start with vibration towards diagonal, not up, diagonal. The muscle is here. So let's go with slow, like a little worm in the ground, that's trying to get home towards here. Vibrate. We're gonna do a couple of the things for the eyebrows, so everybody can't go with lifted, open.
And I do this every morning now. I really have noticed a difference.
Yes, because the fascial system has memory.
And the vibration, I find really I really feel what I'm doing. I feel the fascia. I feel what it is we're going to be working on when I start with this. And
Trinny, go also right here around the temples. Temples. So place your hand like this diagonal and go along like this on top of your ear. I'm interested in on top of your ear as well. That's issue. Yeah, good. Yes, and when you go into the hair, be a little bit more demanding. When you're on the face, but in your hair, be a little bit more maybe spiky with a little.
You have the best vocabulary. I have to say, I do love your vocabulary. It makes me chuckle. It's very, very appealing.
Oh, thank you, thank you. I'm working on that. You know, it's very hard. Oh, look. Now, since already the muscle, we're going to do the rolling. Second step, it's a roll. This is actually isometric lifting of the tissue. We're going to take the roll like this, not the skin. The skin has nothing to do with it. We're going to take a deeper roll, and we're going to start rolling it. Don't take it right next to the eyes. Take it like on your temple, and start rolling it towards your ear. You're going to put it exactly where
So I'm picking up
it belongs.
actual skin and just trying to...
You're picking up a little more than skin.
So
you're picking up
I'm
as
picking
deeper
up,
as you can.
Okay, as much as I can towards the skull and rolling it towards the back. What's this hand doing when I'm rolling with this hand?
You
are they
need
both
to use
doing it?
two hands. Try to use two
I
hands.
see. I'm picking it up. I got it now. Picking it up and I'm rolling it back, keeping it in my hand.
Towards the ear, be like past your ear.
Okay, past my ear.
Yeah, it's a workout.
Yeah, it's good.
Your eyebrow is already higher, and you can tilt your head so your tissue kind of almost falls into your hands.
Yeah, got it.
And it's less tension on your neck. We don't never want to compromise our neck while doing the good stuff for our face.
Yeah.
Now we're gonna take that tissue and we're gonna lift it up. So the same way we take this horizontal fold like this.
Mm-hmm.
And we're lifting it up.
Lift it up. Okay.
Up.
Yep, got it.
Up. We are working with
some people are going to have less skin than others, aren't they? So what if people have hardly any skin to lift up and roll?
They will need to start with a vibration, because we try not to roll the skin, we're trying to roll the fascia underneath.
Yeah.
So it just tells you what situation is going on right now, that everything is adhesed there, and your eyes, especially your under eye, doesn't have a way of draining itself.
So then they might just do this sort of vibration
for a while, until the tissue gonna let them in.
Okay. What happens if somebody's had filler here, Anastasia?
Depends how old the filler, but it will metabolize faster. I want to believe in that, but you can't really move it. You will feel it. And around the filler, what I say, be cautious, because filler is the substance that attracts water. So whenever you work with obviously you increase the circulation and you bring a little bit water. So it can cause temporary edema. That's why you need to be careful. Yeah,
anyone who's had filler around here, years ago, I have had filler in my temples. But about 5 or 6 years ago,
First of all, I like for people to understand where the eyebrows, or where is the eyebrows, is where it belongs, or did it move down? So your eyebrow has to move like in a in a regular skull, maybe up 1 centimeter. I've had people that I go with the eyebrow goes up to here. What does it mean? It fell down. It means that it fell down. So we're going to take a hand. We're gonna put this like this. So this is important position. You place your palm, you place your thinner part on the hand, because this is going to be your leverage, your fulcrum, and now you tilt your head down and you give your body a little time to go deeper. So don't move even now yet. Now you wait it a little bit, and this is a moment when you work with fascia. You go super slow, like 1 millimeter in the second. You move your eyebrow up and you don't let it go down.
Am I moving it with one finger?
Yeah.
Or am I moving it with my knuckles?
That's too rough. You're not gonna feel much.
So I move it with one finger or my
Yeah.
knuckles? Which one?
Finger.
With my
Finger.
finger. Okay, so it's my finger. Okay. Yeah, got it.
Give it time and really slowly. You don't lose it. Don't lose it till the, you see, don't lose it. Don't lose it. I'm still holding it. And then you go up to the
Got you.
hand.
But you're just doing
So-
this with one finger that's hidden from our view then? Or
Yeah.
are you doing it with two or three?
One,
Great,
because
good to know.
I'm
Because you know what,
doing-
when you did your film on Instagram, I thought all the time you were doing it with your knuckles. And so I was trying to do it with
you
my
will lose
knuckles.
you can do knuckles, but it's more like for forehead.
Yeah.
With the finger,
Fine.
you can
Okay.
actually drag.
Yeah.
So, and the most important is not, you see, you're losing it right now. You're losing the eyebrows. This is where you need to slow down. This is the facial work.
But this is, so now I'm keeping it. I'm keeping it.
You keeping it, and you are really on the frontal bone on your forehead. And you keeping it as long as possible up. You will see how, you know, it wants to go down, but you keeping it.
Okay.
You changing your fascia. You changing your position of the eyebrow. And you also create this little numbing effect for your forehead muscle that really similar and safe alternative for Botox. And again,
Anastasia,
coming back.
Is it also the side of my finger that I'm doing
Side
it
of
with?
your finger.
It's the side of my
because
finger.
you need to have it.
Yeah.
You're doing it with this
brown.
bone. Yeah, you're doing it with the side of the bone.
Yeah, I got it.
Hold it slower, like you really. Have you ever made porridge in the pot?
Yeah,
and
a lot. My mother is Scottish. We always make porridge in the pot.
And then the pot got that porridge on the bottom, and it's really hard to scrub it out.
Yeah.
You have to put a little pressure on your pot, but you don't want to scratch it. You want to just remove that porridge that got to the bottom.
I got you. It's like making scrambled eggs. It's like making scrambled eggs. When you make it.
This is a good idea when you work with your forehead, that you want to have the pot clean from your dried porridge.
Okay.
And you go up to the corner, again, lower, 1, 2, 3, then start move. You feel don't think about your skin, don't think even about the muscle, think about the bone, think about that plastic wrapping on top of the bone that with age gets stiffer. And when things get stiffer, they get smaller. When things get smaller underneath your skin hangs. It's not the saggy skin, it's your tissue underneath.
Okay, great. I hope everyone's feeling, Faith, Kira, is everyone feeling it? Are they doing it?
Oh, yeah.
Great.
Yeah. It's really, I mean, it's complicated, and getting it right, I think you're really highlighting how important it is, Anastasia, that we really looking in a mirror and make sure we're keeping that brow lifted as long as we can.
Yes, because this is good for forehead, but it's not going to permanently change your eyebrow. You're not going to get accused
already,
of
look at the difference, everybody, between that and that. I mean, can we do a screen grab now, please? It's like I look like, do you ever remember there was a very funny film with Adam Sandler and Jennifer Aniston, and it was about Beverly Hills plastic surgery thing, and she came and said, I've got a problem. He said, what is it? She had this brow here, and they tried not to laugh. I feel like that woman now. Just go with it. Thank you so much. We have the title in the room.
And right now, Trinny, when you feel like that your eyebrow wants to go down, really like we working not on the body, we're working with the body. So when your eyebrow feels like it wants to go down, what you're gonna do, you're gonna relax your shoulders, but you're going to be very like, again, think about that part, think about the forehead, thinking that you're trying to really address your bone. You don't think of the skin, you're trying to really be on the bone. You are very slow. You're like a super turtle slow.
Yeah. It's
Super
quite, I mean, invigorating as well, but like getting my whole arm around, I find quite the contortion that it takes.
Well, yes, but mobility of your shoulder joints.
I need to work on that next. Can we do the other side as we chat? Because otherwise I'm going to leave the room and it will look weird. Yeah.
Absolutely.
Okay.
The most tension is at the beginning of the eyebrow. Why? Because there are three muscles. So we always start with the beginning of the eyebrow, not with the lateral, but with the beginning. So you're right now on the corner.
Yeah.
Let's go to the beginning.
Okay. Oh, okay. Yeah.
So you grabbed it.
Yeah.
This one is and I think not only, aesthetic benefits. Right now, you touching into your frontal bone. You touching into your frontal lobe of brain. What is frontal lobe? It's our reactions. It's emotions.
Yeah.
It's not about the bad situation. It's about how you react on that situation. So right now, we are canceling all of what happened, how we overreacted. We are touching into the nervous system. In osteopathy, you already think about you on the frontal lobe. You're really regulating your emotions. Moreover, there has been a research that showed that the tension of the facial muscles is correlated to the depression and correlated to the anxiety. So whenever you touch to relax your muscle, your brain gets the signal, okay, I was frowning, I got my muscle contracted, now I am not contracted, I guess she's not frowning, I guess she's not upset anymore. Let me give some good hormones to her.
Mm-hmm.
So anytime people are like fighting on me on that, I'm like, you fighting against mental health at this point.
I mean, there is definitely a strong correlation between the two, and it depends the extent of your belief in that. There's a biological connection, but also that you've got to bring people there emotionally, Anastasia. Are we still doing this eye, or are we moving over?
Yes, continue doing, yes.
So
but
in the corner, so we're now in the
doing
corner. We're in the corner, right? More.
Let's do the corner. The corner is such a tense place. It deserves couple strokes.
Yeah.
But I would like you, Trini, because when you do, you see, you kind of moving the tissue towards the middle. I would like you actually try to move it up and towards the side. So you're not going this
like
way.
This,
you're going,
then. With the same side. You're doing it from the top, but I'm now doing the same hand at the same side. And you're doing the opposite. Can I do the same hand?
Yeah, the hands, it's a little more how anybody more comfortable. I like this because it gives me bigger leverage.
Yeah.
Keep it. Especially here around this area, this is when the eyebrow wants to fall in. Oh, very good. And then you wiggle.
I love your wiggle.
Wiggle into your hair. Then you can go on the middle part.
Mm-hmm.
But you have to be slow.
So I'm doing I'm doing the other eye now, am I?
Yeah, you can, yeah, you're doing it right now. Slow. I'll tell you when you need to be really slow, when you need to pause. Continue doing, I'll tell you pause. And this is where you're gonna kind of pause here and compress to the forehead even more, you pull, you closer to the bone. So here it goes good, and here compress it slower. Yes, here. Give it a second, give it 2 seconds on one spot. You're repositioning your eyebrow. You're repositioning, you're opening your eyes, you're removing the tension from your frontalis muscle. You can play with hands.
Yeah. So tell me something, when you talk at the beginning, you were mentioning about how it can be, you know, gua sha is a temporary thing, whatever, but with the fascia, you can change it, like shift it fundamentally. If you work at it for, let's say you did a month of doing every day, then how often do you need to keep it up? Because it's a lot of intense work on yourself, you know, and I think on a practical level, how much you'd have to do every day or how many days a week once you've done, what is your protocol for the best results?
I'm gonna be honest, fascial system to change on a deeper level to like really almost unrecognizable, you have to give it at least 4 to 6 months to stabilize.
But for
So
how long are you doing it every day for 4 to 6 months?
For 4 to 6 months, you can do it 5 times per week.
Okay.
You can do it like with a little day off every day. Then after the first 2 months are the most intense.
Yeah.
Then you kind of already know yourself and you know exactly which area is your problematic area.
Yeah.
For example, if you have a lot of facial mimic patterns, a lot of, you know, you talk like this, you all the time, like, you know, like you can't control it, then of course those would be your zones to come back.
Yeah.
So realistically, you know, when I work with my clients that I work for a while already, we kind of do a longer sessions after 4 to 6 months, a longer, but less like you do
less
the
frequently. So you might do sort of 2 times a week, a longer session.
And I say, you know, I know it's if you know what you're doing and you know exactly, you put the mirror, you put the podcast, you put some video that you like, and you enjoying it.
Did you say
it's
beer? Did you say podcast and
no.
then a beer?
Mirror.
A mirror that you like. I think you said beer, and I thought you're really chilled. Okay. So it's
but
all about
you should, if you want, you should put a beer. Like the life is too short.
It is about enjoying yourself. Yeah.
You know, I'm not like, this is you have to enjoy it, and your stress level, if you consistently stressing, that's what going to ruin you faster than not having a massage.
Can I ask you something, because I know you talk a lot, and I think soon we've got to think, but I know you talk a lot about not needing to do Botox, things like that, but if somebody, because quite a few people watching might have had filler or Botox, so if you've had Botox and you're doing this, is it just going to make the Botox stop working quicker? Is it, you know, I mean, you believe people don't need to do this if they, you know, but some people might want an injection every 6 months.
After 2-3 days, Botox is basically already left the tissue. It's just the effect. But Botox, it's a toxin. So your body is doing everything it can to metabolize, to get rid of it. It's bad. It doesn't like it. So increased blood circulation will help the body metabolize it faster. You will see your Botox wears off faster. But you, at the same time, when you paralyze the muscle contraction is A, what moves lymph, B, what moves blood, so your skin can eat. So with Botox, with full paralyzed muscle, a lot of people experience, and this has already been even said by dermatologists, a skin thinning, because skin doesn't eat. You don't use it, you lose it in the body. This is how it works.
Because I've done Botox since I was 35, and mainly because I used to do a TV show in England and my forehead moved a lot and I didn't want it to. It was like a Tefal head, you know. So, but what I have noticed, because I've now done it twice a year since I was 35 and I'm now 60, is this skin here is really thin. Like if I wash my face, Anastasia, and I use a flannel, I can easily get to rub off, you know, like a little red scab. So can I get that skin thicker again by doing fascia? Yeah.
Yes, you can. You can, but we also need to control your diet. You know, if you want something thicker, you need to be in the proficit of the calories. This is like, can I get my cheeks back? I'm like, yes, you can. Relax those muscles, but eat like athlete. The same with you.
Eat like what?
Can you eat like athlete?
Oh,
Like
yeah, I mean, I eat, because I am 60 and I'm postmenopausal, I eat a lot more protein. Yeah.
So that's super important.
Yeah.
I'm gonna be realistic. In order to build up, you need the nutrients and you need the blood circulation. Yes, you can. You can make this area a little thicker. You can also, obviously, you will need to the skincare that also, you know, protects that layer of the skin that's just like on its last breath. And of course, blood circulation, relaxation, repositioning, a lot of how do I as my teacher says, you know, like with a blanket, the blanket, when you wash it, it's like gets like this, like a little here, and you want to put it nicely all over even. So
you need to sort of stretch it out again.
So this is what happens with our subcutaneous fat. So in order to have that, you need to like
shake it up a bit.
Shake it up and put it how you want it to be.
Yeah.
And guess what?
It's redistribute the subcutaneous level. Yeah.
And your fat is organized by who? Fascia. Fascia is like this. It's like with the knits that like tick, 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 put in it. So it's quite fascinating, you know, and to see like how, I mean, the before and after is a lot of
are incredible. And I mean, Anastasia, I would like to chat to you for hours, but unfortunately our time is up. I want to thank you so much, and I want to just mention to anyone who's watching this now, anyone who's watching it later, which will be more people. If you want to understand more, go to Anastasia BeautyFascia. We'll put the link in, but it is amazing to learn about our skin better, what constructs it, what's underneath, what affects it. And Anastasia has her point of view, and there are many points of view out there. But I really have to say, I love your point of view. I love the way you talk. I think you talk with a very good knowledge. I think you've also, just to give the accreditation to you, Anastasia, I know you've learned fascia with one or two really world experts who've taught you that you talk about a lot. And so I feel you're always on this learning journey. Yeah. But thank you so much.
Yes, thank you. I'm very thankful for you giving me this opportunity. Yes, I did study with top tiers about fascia. I'm a structural integration practitioner. I've been board certified. You know, it's a long list that brought me there, but this is all true and evidence-based.
If we can stay on the Zoom for 2 minutes, it'd be great to chat to you one-to-one. But I just want to thank everyone who's watching, and for those of you who are going to tune in later. I hope you enjoyed this, and thank you so much, Anastasia.
Thank you. Bye-bye.
Bye. Now I can